Hi, my name is Maria and I am in Nursing 4215 Global Health Practicum for the spring semester of 2019. So last week we were answering questions about a nurse and how caring she was, how empathetic she was towards the patient. This week we're talking about the pain management with a mother after delivery. If I was the nurse talking about pain management and I just admitted this patient into my room, I would go over our pain scale. So I would say, okay, pain is very important for you to keep up with medication, or depending on if it's a vaginal delivery, if it's a C-section, we would treat your pain a little differently. If it's a vaginal delivery, then we're definitely we'll start off by scheduling some ibuprofen and some Tylenol, as long as you have no allergies towards those. We would give you that every 6 hours for the first 24 hours. It's up to you whether you want it or not, obviously, but it is scheduled probably for about 24 hours. Our pain scale that we go by is 0 to 10. 0 being no pain at all, 10 being the worst pain you can ever imagine yourself being in. So that being said, everybody's number is going to be different. Some people are going to tell you that their pain is a 3, and they're in a lot, and 3 is a lot of pain for them. Some people are going to tell you that 3 is manageable. They don't want any pain medication for it. So you have to really look at the patient, look at their vitals. You can tell a lot by someone's heart rate, by their blood pressure, whether or not their pain's getting worse. You can tell by their face, you can tell by the way they're moving around the room, getting in and out of bed. So get to know your patient and figure out where they are on that pain scale and what you can do for them. You can offer heat packs, you can offer ice packs, you can give them more pillows, tell them to listen to music, something that calms them down if they don't want to go the medication route. Now, if you have a vaginal patient and ibuprofen and Tylenol is not working, then that's when you need to talk to your doctor, page them, and go from there. But that's what you're going to be given. Now, for a C-section, it's a little different. You're definitely going to be scheduled Motrin and Tylenol for the first 48 hours. Sometimes the Tylenol might go away, but ibuprofen is typically given and is tolerated very well by patients, and they seem to like it. It helps a lot with the cramping also, which a lot of post-delivery mothers will get when their uterus is shrinking down. They will get a lot of cramping, and with each child it will get worse. So in addition to ibuprofen and Tylenol, they will also be offered oxycodone if their pain is getting pretty bad. You can alternate between ibuprofen and Tylenol and oxycodone, otherwise known as Percocet. Percocet is definitely a narcotic. It has acetaminophen and acetaminophen as well as oxycodone mixed together, and that's basically what's in Percocet, and it is a narcotic. You can, if they haven't taken it, you can say a lot of patients will get sleepy on it. Some patients can have constipation. They can get nauseous from it. They can get dizzy, lightheaded. So you have to really let them know they're already sleep deprived, that this could make them even sleepier than they already are. It's important to tell the mum to, if they're feeling sleepy, put the baby in the crib, not lay them next to them, especially if they take a narcotic, such as Percocet. So you've got to be really careful with it. You also have to look at people's history. Do they have substance abuse? A lot of people with substance abuse also tend to have more pain issues and require more pain medicine. So you have to be very wary and know your patients well. Look at their history. Take another 2 minutes to see if they've had any substance abuse, because it is something that can be, they can get addicted to again quickly. Now, for the most part, if you've had a C-section, you're only going to get about 10 days worth of Percocet to go home with, which should not be enough for someone to get addicted to. So talk to your patients, be completely honest with them, and just let them know what each medicine does, and if there's other things you can do other than medicine. Because sometimes basic things like a heat pack can help pain. A lot of people will have back pain right after delivery. If they've had an epidural, they may not need medicine, they might just need a heat pack. So like, go back to the basics. I think that's very important as well when talking about pain. Give them something that's comforting other than medicine. And also let them know that it's good to alternate, and educate them for when they go home what they should be doing. Not just in the hospital, it's important moving forward what they should be doing with their pain medication, and have them teach it back to you, which I think's key, so they have it in their head as they're going home and walking out the door. All right, thank you so much.